Hello, my name is Zach Drury. I'm a nurse educator at the Huntsman Cancer Hospital and also a doctoral nursing student. I'm going to be talking about a project that myself and Mindy Orr, who is also a doctoral nursing student, have been working on over the past year or so. Really, it's about providing end-of-life care in acute care settings. A lot of the modules are geared towards critical care, but it can be utilized in any acute care setting. So it's a 4-part module, and what you're going to do is the first one is on kind of terminal extubation, the basics of end-of-life care, and then also why we need education around end-of-life care. The next one will be recognizing signs and symptoms. The third module is kind of treating those signs and symptoms, and then the fourth module goes around communication during end-of-life care. So like I said, this is the first of a 4-part series. This first one, we're really going to talk about terminal extubation, some of the basics of end-of-life care, and why we need education surrounding end-of-life care. So some of the outcomes that I expect from you guys to get from this are to understand why nurses and providers need end-of-life care education in acute care settings. And then I want you to be able to list some of the steps around terminal extubation, and then just know some of the basics of end-of-life care in the acute care and critical care setting. It is vital for nurses and providers to be educated around the end-of-life care. We as nurses often perform life-sustaining therapies for our patients in critical care units. Oftentimes, though, due to their disease process, this may involve, like typical critical care, may also involve comfort care or end-of-life care. During these situations, we have to often think about medical situations, legal and ethical. It's been seen in the literature that very few providers and nurses are actually trained in providing end-of-life care or comfort care, as some people may like to call it. Based off of this information, there's actually a fair amount of deaths that happen in critical care units just due to the acuity of these patients, that nurses must be trained in order to provide some type of quality at the end of life for patients and their family. So we found it essential to develop training to assist providers throughout this process. So there's literature out there that shows that there's a lack of knowledge within the nursing profession for nurses to provide end-of-life care. There's also evidence that supports that the best way to train nurses around this topic is with a multidisciplinary approach. And so through a team approach between myself and different collaborators like pharmacy and social sciences, we've developed training to help guide you through end-of-life care. And so that way you can provide the best quality during this time for your patient and their families. So I've briefly discussed this on the outcomes, but again, I just want to briefly go over the goals of education for you through these 4 modules. And so first, we really just want to create an awareness that there is, a gap of knowledge for critical care nurses surrounding end-of-life care. And then also we're going to describe the nurse role before and after terminal extubation. And then we want you to be able to recognize distressing symptoms during end-of-life care. Also, the last part is we're going to provide you with some communication tools that you can use with your patient, your family, and coworkers during end-of-life care in the ICU. So transitioning a patient from like aggressive measures in the ICU to more comfort care or end-of-life care, it can occur in many different ways. It can be rapid, it can be well-planned. There are several different ways that it can happen. Regardless of timing, though, there are some things that need to be identified for both your patient and your family members before you move on to this. And so some of the things that we suggest that should be identified during this time of planning and transitioning to end-of-life care would be, who would the patient or family like to be present during this moment? Are there any like spiritual or religious beliefs or death rituals that need to be observed? And would the family like to, take part in caring for the patient or their family member during like cleaning the body after end of life? And then also, are there any funeral arrangements or any other arrangements that need to be made after the patient passes away? So not all of these questions need to be asked by nurses, and there are many other questions and many other circumstances that you'll run into. It's very patient specific. But this is a good time to work with an interdisciplinary team to ensure that you have social workers, managers, providers, physicians, all going in and asking these type of questions and making sure that we have a holistic approach to transitioning from aggressive measures to end-of-life care for our patients. All right, so we're going to talk a little bit about removing the endotracheal tube or terminal extubation in preparation for end-of-life care. And so once the decision has been made to move to comfort care and the patient is intubated, oftentimes one of the first steps after you've gathered information and prepared to move on, like we discussed before, will be terminally extubating the patient. And so you're going to need to communicate with respiratory therapy and physicians and providers to ensure that the team is ready to do this and the patient and family is ready to do this. Some of the equipment that you'll need after you have the people around that are going to perform the procedure and everyone's on board with performing this procedure will just be, it's pretty simple. It's just like a suction setup and a Yonker pad, and this is because there's a lot of secretions involved during extubation. Then also, I think one of the most important parts around terminal extubation and the actual procedure is communicating with the family and some of the things that they're going to see when you actually perform this procedure. And so you want to make sure that you're going to tell the family what the procedure looks like, what it involves, who's going to be in the room, and the role that you play as the nurse as well as like the respiratory therapist. And another thing that we'll talk about more in the managing distressing signs and symptoms module is pre-medication. And so oftentimes if you are in your assessment as a nurse and you see your patient may have some type of distress when you're pulling the tube, which is very common, it's very common to also pre-medicate the patient. And so this is something that you work with your provider on and decide, does the patient need like an opioid of some sort or an anxiolytic when you're extubating this patient. So this slide really just describes the procedure of extubation. This can be like considered for terminal extubation or just a normal extubation, but really I just want you to be familiar with what the procedure looks like and who is present. And so as we stated before, the patient's family can stay if they want. It just involves like you educating them on what the procedure looks like and telling them you guys are welcome to stay if you want or not. And then you'll be involved as the nurse and then the respiratory therapist. And so some of the steps are the RT will first suction the endotracheal secretions through the ET tube, and you as a nurse or the RT will suction oral secretions. And so this is kind of ensuring the patient's comfort so they don't have a lot of secretions after the extubation, immediately after. And then the next step is that the RT will go ahead and deflate the cuff on the ET tube. And then when they're ready, they will pull the endotracheal tube. And you as a nurse during this time, oftentimes you'll have a Yonker and you can also suction out oral secretions. And then the procedure is pretty much done at this point. The patient is extubated. They may be put on oxygen for comfort, but typically they are not. It's just, their new comfort measure would be treating, dyspnea with an opioid or some other tools that we'll give you later. Some of the tips that I like to share with you is it helps sometimes to have the patient as upright as possible, and so this is for comfort with secretions. And then also, as we stated before, it's important to pre-medicate patients if you feel like they're going to have discomfort with this procedure, which, as you can tell, this is not a very comfortable procedure. So although this can be an emotional time for the family and for the patient, once the decision has been made to perform terminal extubation, do not delay terminal extubation, because really this is a time that you are just prolonging something that's uncomfortable for this patient when we could extubate the patient and start working on controlling their signs and symptoms instead. All right, now that we've discussed the importance around educating critical care nurses around end-of-life care and also some basics of terminal extubation, we can move on to the next module. So the next module is going to be surrounding recognizing distressing signs and symptoms during end-of-life care.